This is a CBC podcast.
People with disabilities in Mikinduri, Kenya now have a new rehab center to get care. This wouldn't have been made possible without the Mikinduri Children of Hope Foundation. For the past couple of years, the group has fundraised and worked with the Kenyan government to start up a center to help people with physical disabilities. And the center is finally operational. We have Ted Grant with us here in the studio. Ted is the president of the Mikinduri Foundation. Also joining us, Dr. Ed Harrison, who chairs the community-based Healthcare Committee. Good morning to you both.
Good morning, Max.
Morning. And congratulations on making this a reality.
Thank you.
Thanks.
Thank you. It feels great.
Ted, why was it important to start this rehab center? Why was there such a need for this?
There's such a need, Matt, for several reasons. One being that this area of Kenya, it's a remote area, is badly underserved by the Kenyan healthcare system. That's the first thing. The second thing is people with disabilities as a segment of the society is even worse equipped to deal with their situation because of their conditions and the remoteness of their community. This information came, or this condition or the circumstance came to light as we did our annual clinics, and many of the people that we saw were people with disabilities. And so as a group, as the doctors and nurses and so on, felt it was important that we have to be able to do something with these people. It became evident over time that we had to do something to address that situation.
And how did you take it to that next step? How did the rehab center actually come together?
Well, with the help of Dr. Ed and others on the community-based healthcare team on PEI, as well as our staff over there and the board of directors over there, Dr. Ed and I went over and we started networking with the Association of Physically Handicapped for Kenya. We started networking with the Ministry of Health for Kenya, and we had a 3.5-day meeting with those strategic partners and others to come up with a way of addressing this issue. So each of those strategic partners took on a segment of the project. Right. Our piece of the project was to raise the funds to build this beautiful rehab building. The Ministry of Health's role to provide the medical staff when the building is opened, and other people had other responsibilities.
So you were bricks and mortar, and then they put the employees in place and maintain it.
And I think it's fair to say we were also sort of the thrust behind it.
Sure. And how did you raise those funds? Were $70,000?
$70,000 was the amount we had to raise, and the PEI community, individual donors who were willing to listen to our story and just came up with the money. You know, we had one donor that gave us a nice amount of money on the basis that we could get other people he would double other people's donations, and so he and his wife would do that. And so in 2 months, Matt, we raised the $70,000. It was amazing.
Dr. Ed Harrison, how did you get involved?
Well, as Ted mentioned, the Mikinduri Children of Hope has yearly medical clinics in which they partner with other health professionals in Kenya. And I went over with a group in 2009. When we finished that clinic, a number of us got together and said, good, we did some good things when we were over there, but what did we leave on the ground? And that was what led to us forming the Community-Based Healthcare Committee. When you look at community-based healthcare, there are a number of groups that are targeted specifically with those programs because their health needs generally tend to be undermet in developing countries, and those include pregnant women, infants, young children, the elderly, and the disabled. My background is physical medicine, rehab medicine. I was interested in seeing whether that particular group with respect to community-based healthcare needs could be met.
And there were a lot of needs. How surprised were you by the number of disabled people that you saw in those clinics?
Well, it was quite impressive. And then we chatted with the Association for Physically Disabled Kenyans, and they agreed to do an assessment clinic. And the next year when we were over, they saw approximately 250 people in one day with 10 rehab professionals, screen them, and that really led to their talking to us about saying there's a critical mass of patients here in this community that would benefit from a rehab center. Will you partner with us? And Ted and the board then explored that with us over the next year, and
the ball was rolling.
The ball was rolling.
Having this rehab center in place, what is your sense of what kind of an impact it's going to have on the lives of those people?
It will have a huge impact. These individuals had no access to services in the past. They had no access to wheelchairs. They had no access to prostheses. They had no accesses to bracing. They had no access to learning to be independent again the real issue now will be continuing to work with the group there to ensure that we can continue to make this a more robust facility. So my hope would be that we can partner as health professionals in rehab with the folks over there.
And Ed, I know both you and Ted, you both had a chance to go for the opening of the center a few months ago. Ted, what was that like for you to see this? You know, you helped raise the funds, you were the driving force, and there it is.
Well, you know, in Kenya, folks are very political, and meetings in a small village, even like Mikinduri, brings in a lot of politicians and so on. And when we were there, they were leading up to national elections. And so the day that we had the opening for the facility, we didn't have many dignitaries there. We didn't have the MPs, and we didn't have the other people. And that was wonderful because, you know, the dignitaries were the mothers with the poor little babies that were sick and, you know, that needed the services. So it was, we had a tent full of mothers and fathers, mostly mothers, with their disabled children. And honest to God, it would just, it would break your heart to see them, but it was a beautiful, beautiful, it was the kind, it was almost meant to be. You could feel like it was meant to be. Like it was great that there was a national election because then we could just focus on the people that had disabilities and
not the speeches and the ribbon cuttings and all of that. Yeah,
that's right. In fact, we had one little disabled child cut the ribbon, so it was wonderful. It was just, I can't describe it.
Ed, for you?
Yeah, it was almost surreal to take persons with disabilities and their families on a tour of the building with the health professionals who are going to be working there, the occupational therapist, the orthopedic technician, physiotherapist who are going to be there. It was sort of introducing everyone to everyone else.
And to the next phase of their lives, really.
Yeah. It was
and with that
cool.
in mind, Matt, you know, one of the things that happens in Kenya, and I suspect other African countries, is when people are disabled, sometimes they get locked in the back room. So I'm thinking my own view of this is that the door is now open for these people that are hidden in the back rooms. This is their coming out party, I hope.
And as that door is open, Ted, Ed was speaking a bit about the future. Where do you hope to see this go now that it's a reality?
Well, first of all, we want to make sure that it's operating the way we want it to operate by not just our standards but international standards, so that it's really operating well, and then. In fact, we've already done some work about starting reach-out clinics because many of these people are in very remote places. If you're badly disabled, you're not going to make it to the facility. And so one of the things we already have a plan in the works to spend one day each week in reach-out clinics to these outlying areas where the services can be delivered to them rather than them having to come to the building. And this building is it's a beautiful building by Kenyan standards. It's a really high-class building. In fact, there are people coming from as far away as Nairobi, 5 hours away, to come and see this facility. So it's getting attention.
Such a pleasure to speak with you both about this morning, and I appreciate you coming into our studio. Thank you.
Well, I'd like to thank you, Matt, because it's because of the opportunity to get on the air and talk about this that it enables us to thank the PEI community for their incredible generosity for supporting us. Without the churches and without the individual donors and without the businesses, we'd be going there empty with nothing to do. So they deserve the credit for this.
It's a real island project, and it's working.
Thanks to you both. Congratulations.
Thank you,
Ted Grant is president of the Mikinduri Children of Hope Foundation. We were also speaking with Dr. Ed Harrison.
Looking for more CBC podcasts? Go to cbc.ca/podcasting.